All right, let's get rolling. Dr. Calvin Luk is our first presenter out of our three today. Kevin is the consultant architect of Rehab Aid Society and a clinician doctor in Chinese medicine. Kevin's expertise encompasses architecture and medicine in Australia, Southeast Asia, and China. Kevin is also a founding chairman of Association of Universal Accessibility in Hong Kong. So he's an architect and a doctor. Thanks, Kevin.
All right, good afternoon. Thank you, Angela, for the introduction. Yes, I'm a medical doctor in Chinese medicine specialized in acupuncture and with previous training as an architect, mainly with Rystop in Australia. And I come to Hong Kong after setting up an office for them in Indonesia. So my experience in health and architecture comes from a very different, maybe, perspective, and sometimes maybe a combined perspective that might have some benefit to share with everyone here. Okay. Before I start my presentation, just want to do a very simple illustration. It's not, where's Kate? It's not that thing again. It's a very simple illustration. You see two pictures here, and there's a description there right next to it. It says bright, dynamic, vigorous, rising, outward, spreading, and opening. Do you think the picture on the right or on the left will relate more or will describe better the wordings up here? Who thinks the picture on your right-hand side, sorry, the left-hand side will describe this description better? Please put your hands up. Okay, not so many. Okay, but there's some. Okay, what about those who think that the picture on the left-hand side would suit this description better? Okay, a bit less. Okay, the illustration shows that these two descriptions are contrasting each other. And in fact, they are the description we often refer to as yang and yin. The bright, dynamic, vigorous, rising outwards is the yang, which is the energy of in our Chinese medicine theory. It all comes from a book we call the I Ching about 3,000 years ago. But this illustration purely shows you that in terms of understand Chinese medicine, it's not so difficult. If you look at this picture and you can show it to your friend again after you download the presentation, Chinese medicine is not something that's too abstract to be understood. So there is a common language in it, and which we'll be coming to. Okay, going to my presentation with three simple parts. The first part introduced you to some background and its relationship with TCM, traditional Chinese medicine, and salutogenesis. And that's the reason why we're looking at it, because we think that both agree with each other and they complement each other. And the second part gives you a very brief understanding of how TCM can do for the sickness of dementia or Alzheimer's disease. I picked this particular topic because there's a lot of method that we can use environmental intervention to help to stop the progression of this disease, or actually even to give them some healing effects. The last part 3, is what we're really talking about, is how TCM, how traditional Chinese medicine theory, can direct us or give us guidelines to how to design our interiors, our buildings, and get some beneficial effect. This might be in particular interest to those who work your way or do your projects in China, which Chinese traditional medicine can give you a very strong support to the theory that you'll be doing for your client, which you can refer to. Okay, just to begin with two statements from WHO, World Health Organization. The only alternative medicine that's fully integrated into the world is only China. And why is that? I was discussing with other people in the conference for the past few days. Political influence is very important. It's all because of Chairman Mao. You can see his image. The great leap forward. Whether you like it or not, he does put Chinese medicine to be at equal ranking. That's not said by me, that's said by WHO reports. Okay, that just set a background to what we're talking about. TCM and salutogenesis. Definition of TCM comes from a long, long time ago. It's not a tool to cure disease, it's a tool for long life with quality. So that definition is very much lined up with the new definition from WHO about health. It's just not long only about long life, also a life with quality. And the nature, human body and health is all in a symbiotic way. I think that's very well understood in our Chinese culture. And in line with the proactive approach of salutogenesis versus pathogenic, the TCM approach is very much on promotion prevention. And to the point that it says it's even far superior to any form of remedies. But I won't go to detail of it because I'm not going to sell you Chinese medicine today. And again, life nurturing, we call it Yangsang, is one of our culture. And one of the 4 pillars of Yangsang is living environment. And that is why you can see in the later presentation how environment can help our health in a Chinese context. Okay? The reason I have to do this presentation was because I was listening to Professor Dinani's presentation 3 years ago in Kuala Lumpur, and that inspired me to come to you on stage. 3 years ago, I was sitting down like you guys, looking at the presentation. Professor Dinani thinks there's a gap between applying the salutogenic theories to environmental wellness factors. And I believe traditional Chinese medicine has a mean or has a vehicle to connect that. So this is my attempt, okay? And I keep emphasizing the cultural elements in the design for dementia, and that's why I draw 2 examples here. Our colleagues here from the Hong Kong Alzheimer's Disease Association, they use other cultural elements, the 6 arts, to improve the behavioral and psychological behavior of the dementia people. And also in research in Australia, that Richard Fleming, one of the professors that I'm working with on this area, he emphasized the possible advantages of designing for particular culture. So based on this context, and also aligning with the 3 different paradigms of treatment proposed by John Seisel, that's quite a long time ago, environmental interventions are one of the major way of still treating the disease of dementia of Alzheimer's. Pharmacological intervention, in our Chinese context, you can see we can have herbal medicine, acupuncture. Behavioral, we have the 6 arts, like what I mentioned, life nurturing. And on environmental, that is the one that I will introduce to you. It's based on a theory called the 5 elements. But overall, this concept gives us a culturally appropriate approach, we call it. And the details is coming, okay? A very simple comparison with salutogenesis and TCM will give us a very clear picture that health is on an equilibrium. And the positive side and the negative sides of the equilibrium in different theories shown here. The manageability, which is represented by generalized resistant resources, and the negative side is the generalized resource deficits. They both counter each other and try to get a balance, resulting in an increase of sense of cohesion. In terms of traditional Chinese medicine, we have the body positive energy to reject or to defend us for all the illnesses of the pathogens outside. That's what we call Jing Ci. Again, externally, we have it's called the 7 endogenous and 6 exogenous pathogens. Namely, it's the outside and the inside pathogens that make us health. And the balance of this is we achieve a balance of yin and yang, or body immune system. In Chinese, we call it yin ping yang mi. Now, this is one of the most impressive parts that I discovered in my journey of searching for this new concept. This passage has come from 200 BC in a very famous book we call the Yellow Emperor's Internal Canon, or Internal Classic. I think anyone that have been in touch with Chinese medicine would heard about this. And if you can just spare a moment, just read. If you can read Chinese, please read Chinese. If you can read English, just spare a very quick moment. But the next slide will repeat what I'm going to show you. Okay, this is amazing because I have to show you what I have found. What I have found, I haven't even discussed that with Professor Dinani about this. The correlation of these 2 concepts are so precise in a statistical term, we almost can say it's R squared equal to almost 1. Okay, when we talk about how in salutogenesis, how comprehensibility can contribute a sense of coherence, we have the corresponding part here. Almost 2,000 years ago, salutogenesis was first introduced by Antonovsky in 1975, and that's like almost 2,000 years earlier. We already discovered something similar to that. How we perceive the world, that attribute to the comprehensibility. How these image in our heart will turn into purposes and ideals that attribute to the meaningfulness of the sense of coherence. And therefore, we can handle all matters that directly relate to the manageability. The outcome is, in TCM, we call it maturing life. In salutogenesis, it's called stress grouping. So that's just a set of background to the remaining. And this, I have only 2 slides to explain to you about the TCM and dementia, because it's not a medical conference. But the dementia term was first appeared in Ming Dynasty, that's about 1624, which is almost about 180 years before Mr. Alzheimer discovered Dr. Alzheimer discovered this disease. But however, in Chinese medicine, in classical Chinese medicine, there's no distinction made to the Alzheimer disease as against the other types of dementia. Okay. Basic pathology, we believe in, it's also the disease of the brain, but if you get a closer look, we were talking about something like kidney accidents. I won't go into detail of that, but because that's not the purpose of this presentation. But all you need to know is it's something to do with the kidney element in the TCM theory. And we have the corresponding herbal therapy and acupuncture therapy to help to ease the syndrome of this disease. Okay, here comes the main part of my presentation. Theory of 5 elements. Again, some of you must have heard of it. If you're Chinese, I think it's part of your life, daily life. But the important thing about this is understanding everything in the universe composed in these 5 elements that include the nature, environment, our human body, and also diseases. And they all interact in a dynamic pattern. I think that's all of you, if you know about something about Chinese culture, you know this fire, gold, and earth, and all that. Okay. But the most important thing is, in TCM pathology, the elements of nature and the vital organs interact according to the 5 elements theory. When we treat patients with whether herbal remedy or acupuncture, we actually apply the 5 elements. We have medicine, we have acupuncture point to substantiate that. Okay? But the second very important point is we are not talking about feng shui here. Chinese medicine has come to an age that we also follow evidence-based medicine. Okay? We have other medical doctors here. I'm sure that you understand what I'm talking about. This approach of Chinese medicine have measurable health outcomes, can stand up to randomized clinical trials. Okay? In identifying the pathology I just mentioned, there's mainly in the kidney system, also in the liver and heart system, but again, they are not directly related to the anatomical part of our body. It's a wider system. And there's certain therapy, which you will see later, how they interact together. Okay? Based on these 5 elements, we will investigate the possibility of applicating this theory on the design water and garden features, building orientation, solar aspect, and so on. I would illustrate it to you in 4 individual applications. Okay? The first one is we call Earth at Center. Earth at Center. If you look at the picture, you see a common point of the pavilion designs and also the Chinese Yuan. Now, all these courtyard designs, naturally, as an architect, you know, it optimized natural daylight, cross ventilation, access to outdoor space, maximize solar utilization, and all that. But it does more. Okay, I was get Mr. Guy Percy's permission to use his slides yesterday, and we just talked about it. Similar approach was used in a lot of new architectural projects. Mr. Percy was talking about that the reason he put a courtyard inside is allow the children to play there while the parents can supervise them from the courtyard. Okay, but why I say that it's a Chinese medicine theory that could support that is because in terms of 5 elements, spleen has to be in the middle of the 4 cardinal points, which is the north, east, south, and west. East represents the liver system, north represents the kidney system, south represents the heart system, and west represents the lung system. Earth has to be in the middle. And what does it mean for the people, for the patient of dementia or patient with Alzheimer's disease? The courtyard allow maximum natural daylight, to strengthen the daylight clue, to restore the circadian rhythm. And also it provides central focus and direct visual linkage to the area of interest. We call that visual access. These two principles are both extracted from the evidence-based design principle developed by Mary Marshall and Richard Fleming quite some time ago. And a further elaboration from Richard Fleming in 2013, which is just 2 years ago, he refers this to a vision for way of life, which means a lot of times when we design dementia facilities, we have a central focus, and this central focus permit the people with dementia to maintain their daily life with a focus, whether it's the central kitchen, whether a living area, and Richard even say that it could be a golf putting green. So they get up every day, the only thing they remember is their pleasurable time in the kitchen, their pleasurable time in the golf course, and that gives them a meaning of life. And that meaningless, again, come back to the salutogenic theory to improve the sense of cohesion. So now we can see that whether it's TCM or salutogenic or evidence-based design, they all converge in certain point. And in the past few days, I've been discussing with other delegates, and our knowledge in a lot of ways will complement and add on to each other. Okay, the second thing is about the second application is about the water element. We have mentioned earlier the disease of dementia of Alzheimer's mainly record the prime axons, the kidney axons. It's in very pronounced vacuity, which means it has been very inactive for some time. So we follow the Chinese medicine where we call it kidney engender marrow, 腦生水. So I advocate that in order to balance that, we need to have certain water element to supplement that. And the TCM theories give us a clue which says that in order to nourish the yin, it has to be a tranquil, nourishing, flowing, and downwards quality. So coming back for the very first slide that I illustrated to you, instead of using a fountain, you should use something like a gentle descending cascade. And why is that? Okay, I'm just a bit too quick here. Why is that? Because in a lot of behavioral syndrome, or we call PPSD, behavioral psychological syndrome of dementia, they often have a lot of aggressiveness, has a lot of agitation, have a lot of stress. And the water element in a certain way may be designed to help them to ease off that stress, to ease off that agitation, and therefore reduce the occurrence of those negative syndromes. Okay? But at the same time, we're talking about putting these water elements into the interior, into the exterior. But one thing that we've got to avoid, according to TCM theories, don't put it right into the middle of the courtyard, of the central courtyard. Because central courtyard represented by earth spleen, and spleen doesn't like wetness. So this is one of the theory that we can consider to put, instead of in the central courtyard, put in a secluded area, such as a quiet zone in a sensory garden, or somewhere along the wandering path, which is one of the design features for the dementia healing garden, that create a sense of a point of interest. And the third one is a bit more imaginative, I would say. We're talking about atrium and skylight. Oh, sorry. Atrium and skylight. Atrium, to us, bringing in direct sunlight from the top, and in terms of Chinese medicine theory, we call it yin rises over as sky, which means where we have an abundance of sunlight, we have the abundance of energy. Sometimes these energies are not wanted, but we do want, a while ago I was saying that we want to get more sunlight so that to strengthen the circadian system, but why now did I say it's too much energy? It's no good. Okay, it's all about balance thing. So how do we make that balance to be achieved? Okay, is to use an indoor water feature under the skylight in a way that we call it harmonizing fire and water. In terms of Chinese medicine, we have this medicine, Jiao Taiwan, to be prescribed to the patient. So the whole theory here is we're using the same 5 elements approach to prescribe medicine, prescribe acupuncture, and my theory is to use that to contribute to the design of environment to have the same effect. And how this effect can be validated, we can have measurable outcome. We need more quantifiable, more qualitative analysis and empirical studies. And the last one is about liver wound. Liver wound, why we have to cause the liver wound? Because a lot of times these patients with different kind of stress and tension will have a very, we call it congested liver qi. And landscaping is part of the liver wood. Wood means could mean landscaping, could mean botanical nature elements. So it is part of a healing garden. So that I don't need to talk anymore because many people here are experts on healing garden. And access to look at even this natural landscape could give them a healing effect. Again, a lot of you are expert in that. But what I'm going to tell you here, something new maybe, is about the woodwork itself. In terms of Chinese medicine, the wood character refer to something we call it curvilinear and overstretching. Now, this description leads us to think that in terms of building structure and fenestration, the timber elements can be designed, or of course there's a lot of examples there, but why it has to be designed that way, in a combined curve and linear shape, producing a light, airy, and non-obstructive building elements, which you can see. A demonstration of these Chinese elements with curve and linear shape, even on the bridges, even on the facade of a garden wall, the combination of the curve and the linear shape, I believe, have particular influence to the mind and how we can validate. The next speaker, Mr. Petty, Professor Petty, will tell us the curve, how our eyes respond to curve and sharp angles in our mind, in a neurological manner, okay? So that is something that I was saying that I look forward to our knowledge to be exchanged and maybe a step further to improve that, and we can find ways to expand this knowledge. And this is the last slide. The last slide shows us that all those nature of trees which follow the definition I just mentioned, which is the wood is curvilinear in shape, and all these elements are repeated in these very famous award-winning structures that we see. And why we find this so pleasing, why we find this so good, there must be a theory behind it. There must be something that we can prove from neuroscience. And that's why for the next two speakers, you hear the journey on neuroscience to support what we're saying. So I have already gone through that, so I'm not going to repeat that. So that's the theory, which is the one that I just gone through and proposed before. And that's the end of my presentation. Thank you very much.